How did eugenics drive WWII medical experiments? Have you ever wondered how a misguided belief in improving human populations led to horrific medical experiments during World War II? The concept of eugenics played a significant role in shaping Nazi policies and medical practices. Eugenics is the idea of enhancing human populations by controlling breeding to promote desirable traits and eliminate those deemed undesirable. This ideology, often referred to as racial hygiene in Germany, viewed certain groups as threats to the genetic health of society. The Nazi regime adopted eugenic principles to justify brutal medical experiments and programs aimed at cleansing the population. One of the first steps was the implementation of forced sterilization laws. In 1933, the law for the prevention of progeny of hereditary diseases was enacted. This law allowed for the compulsory sterilization of individuals considered genetically unfit, including those with conditions like schizophrenia and epilepsy. Physicians were required to report patients, and special courts decided sterilization cases without consent. Hundreds of thousands were sterilized, often against their will. Another chilling aspect of eugenics was the euthanasia programs. The Nazis initiated secret killing programs, such as the T4 program, targeting disabled individuals in institutions. These individuals were labeled as lives unworthy of living. Victims included children and adults who were often relatively healthy but had disabilities or mental illnesses. Their deaths were falsely presented as mercy killings, but the true aim was to eliminate perceived genetic defects. Bodies and organs from these victims were used in medical research to support eugenic theories. Eugenics also provided a pseudo-scientific rationale for horrific medical experiments on prisoners in concentration camps. Nazi doctors conducted inhumane experiments to test sterilization methods and study infectious diseases on vulnerable populations, including Jews and Roma. These experiments were often brutal and non-consensual, reflecting the dehumanization rooted in eugenic thought. The medicalization of racism became a disturbing reality as Nazi physicians aligned with the regime's political goals. They treated the German state as their primary patient, justifying exclusion, forced sterilization, and euthanasia as necessary medical treatments for the health of the nation. This shift in medical ethics allowed for widespread atrocities to occur. The impact of eugenics on medical ethics was profound. Traditional principles, like the idea of do no harm, were abandoned. Physicians embraced roles as biological soldiers, prioritizing state goals over individual rights. This shift enabled the scale of medical experimentation and killings during the war. In the context of civilians suffering and atrocities, the eugenics-driven medical experiments representing one of the darkest intersections of science and ideology during World War II. They illustrate how distorted scientific ideas can justify systematic human rights abuses. Understanding this history is essential for engaging discussions about medical ethics and the consequences of pseudoscientific beliefs in wartime societies.